Hello, everyone, and thank you for attending today's webcast, Leveraging Technology to Overcome Barriers to Patient Access. My name is Lori Travisano, and I'm the Director of Account Management here at Annexus Health. For many patients, needed care is prohibitively expensive without financial assistance. But oftentimes, connecting eligible patients with available assistance can be a challenge. The goal of this webcast is to show you how to streamline your financial assistance cycle management process, reduce financial toxicity for your patients, and improve the revenue stream for your organization. For today's agenda, we will start with who we are at Annexus Health. We will then define the problem. What are the barriers to patient access? We will look at the impact it has on the patient, and then we will focus on finding solutions. So let's get started. I'm going to start with a quick recap about Annexus Health. I'll go over our mission, history, and our focus. So our mission at Annexus Health is to utilize our innovative technologies, solutions, and services to impact the patient journey. We want to improve the access to intended therapy, shorten the time to start on therapy, and then make sure that patients can stay on therapy and reduce financial toxicity. A little bit about our history. AssistPoint was built in 2014, and Annexus Health was then formed in 2017 in a quest to improve the administrative logistics aimed at expanding patients' access to care, reducing financial toxicity for patients. In 2018, we focused on building a strong infrastructure, and we continued to expand and add new features. In 2020, we closed our Series A funding round, which really helped us in terms of securing strategic collaborations, adding people, and expanding new products and features. That brings us to 2021, where Annexus has surpassed the $1 billion amount or level in patient financial assistance secured. We also launched a new service offering called Paro, which helps practices with their financial assistance cycle management and continue to expand our footprint. Today, we're going to focus on patient affordability. Whether you're talking about assistance from commercial copay programs or foundations, our quest is to reduce financial toxicity and help support practices manage financial assistance in a proactive approach. Let's look at the problem. What are the barriers to access? What keeps eligible patients from receiving available assistance in a timely manner? Many of the practices and organizations we speak with find their current management workflow when it comes to financial assistance extremely fragmented and manual, filled with Post-it notes and spreadsheets, which is crazy in this world of technology today. They typically have to navigate through hundreds of assistance options via individual program, websites, portals. Each program has unique eligibility requirements and enrollment processes. Oftentimes, after submitting an application, administrative staff are so inundated with requests of missing additional information via phone, email, and fax. And many programs do not immediately notify the provider of an application status change, whether it's been approved or denied. Often, once enrolled in a program, tracking and analyzing the award fulfillment of assistance is inefficient and disconnected. We all know that the follow-up is extremely important when it comes to financial assistance, and financial counselors are so overwhelmed with so many to-dos and phone calls. And as a result of this process, it can lead to patients slipping through the cracks. We often see in many practices and organizations that we talk to, they just don't have the human resources to manage financial assistance. There simply is not enough staff to handle and support financial assistance cycle management. And we see problems too with the training of the staff surrounding the complex intricacies of financial assistance cycle management. Many times it falls to staff members whose primary role is not in financial assistance, and they've actually received little or no specific training inside their organization. We often see financial assistance and practices and organizations come with a reactive approach. Oftentimes, assistance is not sought out until after a patient's insurance has paid its obligation and the patient has received a large bill and they have absolutely no means of paying. The impact on the patient. Let's take a closer look at that. What happens when administrative burdens stand between eligible patients and the available assistance? We have found at Annexus Health the impact to be the following. There's an increased financial toxicity for the patients and the providers. There's a reduced access to the therapy. And then oftentimes it takes longer to start on the therapy and a decrease in the duration of that therapy. We all know the problem is real, and financial toxicity can impact a patient's overall finances. In fact, up to 80% of cancer survivors exhaust their savings to finance medical expenses, and cancer survivors are 2.5 times more likely to file for bankruptcy compared with individuals without a cancer history. If you get a chance, please head over to annexushealth.com to hear powerful stories from real patients on how financial toxicity impacted their journey and what they wish they knew. Now let's focus on finding solutions. What can providers or organizations do to reduce the burdens across the administrative patient journey? At Annexus Health, we have 3 very powerful solutions that leverage technology to overcome barriers to patient access. First is AssistPoint, our cloud-based workflow solution, which is going to help you navigate the patient assistance journey, allowing you to search, enroll, track, and analyze. And then AP Analytics is a product contained within AssistPoint that provides practices with data analytics. By using AssistPoint, you're creating analytics in the background at a patient level, practice level, and management level. It's really a robust resource that allows for all the important parts that data plays in effective management and work and processes of workflow. And over the past couple years, we've learned that many organizations or practices just don't have the staff to do the workflow, or they desire additional resources to help them with financial assistance cycle management. So we launched a new part of our organization called Adparo. And Adparo is our service solution, which provides that help with staffing. We use expert qualified individuals to do financial assistance cycle management for access services in total, and can provide the opportunity for many individual areas inside of an organization where there are challenges and can help fill in those gaps. Today, we're going to take a closer look at AssistPoint, the solution that will support and help you as a practice or an organization navigate and manage the administrative patient journey from end to end, using technology to search, enroll, track, and analyze financial assistance for all patients. There are so many ways to help reduce financial toxicity for your patients. You just need to know where to look, and having a single place to store and track the financial assistance will eliminate the need for spreadsheets, file folders, post notes, and it will ensure that no patient slips through the cracks. The first thing that Assist Point will help you do is search for financial assistance for all your patients with our comprehensive library of assistance programs. The Assistance Search Wizard uses real-time content curation technology to quickly identify all assistance options available to a patient from life science organizations, charitable foundations, and other services. We actually have over 1,900 assistance options that are included. And by pulling in that patient demographic information, diagnosis, and insurance details from your EHR practice management system, AssistPoint will search for the programs available in one place, allowing you to compare them side by side to select the best option for your patient. One of our users said that finding assistance programs for our patients takes 10 seconds with AssistPoint, as opposed to 2 hours with our old reactive approach. Next, we want to enroll patients into appropriate assistance programs. High-tech digital enrollment is available through AP Connect integrations with our growing list of life science partners, saving you time on data entry and providing you with real-time approval and denial status. Enrolling directly inside of AssistPoint, there's no more need for those posted notes or portal logins. It's now all in one single place and location for ease of use and follow-up. Next, we want to track. We want to track the activity against the financial award. We obtain immediate access to award updates and balances remaining for programs digitally integrated through AP Connect. Our payment automation provides continuous insight into the spend down of that award, enabling precise tracking of claims and payment and revenue, helping eliminate any gaps in treatment, allowing you to get rid of the spreadsheets. You can now track everything inside of AssistPoint. And then the Assistance Watch List report provides the ability to track patients who have yet not been enrolled in assistance due to funding not being available, and making sure that no patient slips through the cracks. Finally, we're going to analyze. Analyze all financial assistance data within your organization. AssistPoint users and managers will have access to AP Analytics. It's a robust set of filterable and up-to-date, easy-to-use reports. So from a patient level to an organizational level, AP Analytics provides significant insights to help you get the results that you want. Smarter FACM, reduce patient responsibility, and increase revenue capture. The reports contained inside the platform include our ever so popular billing action reports. It's letting you answer 3 really important questions. Did we bill it? Did we get paid? And did we miss an opportunity to find financial assistance for our patient? Now, when it comes to disease fund availability, we all know that time is of the essence. Our internal process keeps providers updated of a fund's availability within 5 minutes. With our foundation's fund tracker, we receive notifications of when a fund is opened or closed and send out email alerts to our users within 5 minutes of that status change. AssistPoint users can then go into AssistPoint and quickly identify and apply those patients who needed funding. FundFinder's good. AssistPoint is faster and allows you to quickly get your patients the funding they need. AssistPoint has been improving patients' access to financial assistance since 2018. We've processed over $1 billion of awards inside of AssistPoint, and that equates to over 82,000 plus applications created inside of AssistPoint, helping practices really save money for their patients. we have seen that there's a problem. So how can we support practices reduce financial toxicity? Well, we want to improve the revenue stream for your organization by connecting more patients with financial assistance, reducing the patient responsibility while increasing the revenue captured. So SysPoint will do that by helping you optimize your revenue capture by ensuring that all assistance programs are appropriately set up in your practice management system, billed correctly, and then constantly looking for additional available assistance. The goal is to streamline that financial assistance cycle management process and reduce financial toxicity, help improve your revenue stream. Many of our practices often ask us, what is the approximate revenue capture with AssistPoint? We have found that practices fully utilizing AssistPoint will receive anywhere from $100,000 to $200,000 per provider. Obviously, several factors are going to come into play, such as practice productivity. Is there an in-house dispensing pharmacy? The payer mix, patient population, free drug utilization, patient adherence, and then the amount that gets written off to collections, or the amount that gets written off. When it comes to moving forward with AssistPoint, we are there every step of the way. We ensure that you are onboarded appropriately. We want to understand your workflow and be able to identify any training priorities. And then we set up a customized training program for all of our practices, making sure that everyone who has access to AssistPoint is able to fully utilize it, whether it's a user or management wanting to see a report or review the information inside of AssistPoint. And then finally, we support you with monthly check-in calls. We do an update every month with our practices to let you know of all new features and enhancements inside of AssistPoint, as well as take back the voice of our customer, understanding any challenges that you're seeing when it comes to securing financial assistance and helping you solve for that. Finally, I want to give you a little idea of our impact of AssistPoint on a patient level outcomes at a provider level, on patient level outcomes at a provider level. So we looked at the impact of patients who were not assessed compared to patients who were worked up inside of AssistPoint. And we found that 22% saw an increase in the speed to treatment, and 15% saw an increase in the number of treatments. So what does this mean? Removing barriers to access will help improve patient outcomes. They'll be able to start on therapy sooner and improve that duration of therapy. Finally, the technology is available and administrative burdens don't have to be a barrier on the access to care. We can reduce financial toxicity for the patient and help increase revenue capture for your organization. Thank you so much for your time today. If you have any follow-up questions or would like to see a demo of AssistPoint, please stop by annexushealth.com and let us know. Thank you again, and have a great rest of your day.